Joanne, for inviting me. I'm honored, and I have nothing new to teach the people at Pediatric. But as you see from this paper, our focus is now nothing less than the hospital department, or more accurately, 2 pediatric departments in university hospitals in Oslo, primarily dealing with children with cancer and their parents. In Norwegian pediatric wards, one parent often has her or his bed at the side of their child. Both parents are granted their sick leave in Norway as long as the child is being treated for cancer, thus keeping their regular economic income. This is, of course, great in that there are neither staff nor patients. However, as one father claimed, it seems to be an unwritten law that it is the parents' responsibility and duty to keep up the psychosocial climate in the sick room. And just like here, we see that many parents are clearly more suffering than their children, and we try to do something about it. Thank you. Must admit that I have so far not found a short and appropriate definition of musicalizing, which is obviously meaningful when it's used in relationship with a physical structure like a hospital. The Oxford Sentence Dictionary states that musicalizing means to set a novel, play, or poem to music. Forgive me if this sounds a little un-English, but I assume that musicalize in our clinical context simply means combining music and other environmental elements. My hopeful hypothesis is obviously that these interventions or activities potentially promote health in different ways, but I'm not talking much about research today. To musicalize hospitals is far from a new idea. If we study Jewish and Muslim medieval traditions of music therapy, we'll find several examples stemming already from the 11th century of hospital-based musical practices which had a much wider scope than the individual patient. Some 500 years later, Antonio Vivaldi composed tailor-made music to be performed in the open spaces of an Italian bath with supposedly healing springs of aqua minerale. And let's just spend some seconds to see what Florence Nightingale wrote about music in the hospital milieu. You can read a little. This is. How many of you have read this quotation before? 1, 2, 3. As you see, there are economical reasons for not having music as much as desired. Have you heard that before? Secondly, Miss N must have had some traumatic experiences with pianos. She said that the nicest melody will simply ruin the sick if played on the pianoforte. But when she grew older, she actually supported projects where the musical ideas were put into practice through hospital-based concerts. Groups of musicians and singers. But I think they had a kind of screen between the musicians and the patients. I don't know who they were going to protect, but that was the case. Okay, now a slide slightly more contemporary historical perspective. In the early or mid-1990s, when I established the first music therapy practices in Norwegian Pediatric oncology departments in hospitals, music therapy definitions more or less solely refer to individual clients or fixed groups. Music therapy definitions often underline that the music should be controlled and or planned and stress the mutual relationship between client and therapist. Neither then nor now I have these conditions or aims to be wrong, and part of my practices hopefully have fulfilled these conditions quite well. However, after having been musicking for some time in corridors and entrance hall, playrooms, as well as working with one-on-one patients in intensive care stations and isolation room, and let's say having collaborated more or less musically with young patients, parents, brothers and sisters, medical doctors, nurses, physiotherapists, and hospital school teachers of various kinds, I found it difficult to put one common name tag to these practices. What was genuine music therapy? What was pure entertainment? And what could potentially be both the one and the other? Each day, therapeutic aims were altered or added on the way. Certainly, these experiences kindled my fascination for the quite complicated web of activities and relationships developed from the music. This kind of practice was indeed a conglomerate of different variables. From this rather simple model, as you have all seen before, to something like that. During the last years of the now old millennium, both in the US, in South Africa, and in Britain, and other places too, some music therapists began more or less at the same time to develop theories and sharing ideas about widening the mainstream music environmental therapy, community music therapy, and of course, musicking. The second edition of Ken Brush's book, Defining Music Therapy, Ecology, referred to both the social cultural community and or the physical environment. As we see, the notion of client is defined quite broadly in many of these definitions. Joined up music therapy, where the word Stuart Wood used to describe the community music therapy approach. And I was particularly fascinated, thinking that hospital was a kind of small-scale community. I was less interested to develop theories, but I wanted to operationalize how music could be used in this community. And these were the related questions I put forward. And actually, I think all of you, whether you are a music therapist or not, might consider, think of these environmental questions. I was inspired by the nurse Susie Kim, who wrote a book on theoretical nursing, but I made this a music therapy thing. Can music make a room smaller or bigger? Which sounds are we having in the hospital? What are the sound levels? Do the patients and staff have possibilities for silence? Which values are present? And which roles do people have related to the music? And how can we develop friendships or togetherness through musicking as the social aspects of an environment? And what comes to time? we know that hospitals are from Monday to Friday, 8 to 4, 5, and then it's you know. And how do people experience regular or unexpected musical events? Can musicking be a pause from the regular life in hospital? Many parents told me that they forgot they were in hospital and when we were dealing with our musical exercises. And I thought that can't be much, just forget. I would bring something else, but now I think that was quite nice. So, for the rest of today, I'll give you 2 examples of what I think is musicalizing in the pediatric hospital department. We start with a regular musical event, and it's offspring. The musical hour was a regular weekly event in several Norwegian pediatric hospitals. I started twice in Oslo, and we got offsprings in actually all the Norwegian university hospitals dealing with children with cancer. Probably the only country in the world. But with every university hospital has a music therapist, more or less. The music-related common activities in this musical hour every Tuesday morning was such as singing, acting, clapping, hands, dancing, the use of puppetry, song makers and the artistic products, or different solists may also be presented. And some features are planned, but improvisation marks both some of the musicking and the very structure of the musical hour. Keyword, performance. No. Okay. About 30 minutes before the show, let's call it, starts, the music therapist, often accompanied by a student and eventually by young patients, walks through the wards playing, greeting patients, families and staff, and asking what they would like to play, etc. This is also one way of obtaining information about patients. So there are many things in my head at the same time, actually. And this is from one of the first musical hours I conducted, and it's many years ago. You don't need to know Norwegian to understand. Here are the musicians, best players in town. Is she going to carry you all the time? What kind of song are we going to play? Cool song or a mystical song? Another patient is coming with a preschool teacher. Oh, he's playing for me. He plays when I'm no, okay. And you know, we are joking. We are sometimes find out this boy must be protected. This other girl can be a soloist and things like that. And then when we enter the hall, we simply do not know what is going to happen. The opening song is the same each time. One of the children is chosen to make the 3 beats of the cymbal, song soloists singing the trills, maybe mothers, fathers, students, etc. And later, tuning the kettle drum, which we got from a patient, is also a job of one of the children. But let's just see the start of a musical hour. It's actually a saxophone, a Baroque trombone from 1585. I need to practice for the Norwegian Baroque orchestra on duty. Who's going to beat the cymbal? I'm just asking. And you see the lyrics here. And just check the lengths of the children now. We start. And this continued here. We have the same situation 5 or 6 years later. It's from the Norwegian broadcasting.
Trygve rundt i barneavdelingen på Rikshospitalet og samlet inn musikkstund som en del av behandlingen. Barn med alvorlige sykdommer som kreft er til daglig satt inn i en rolle hvor sykdommen definerer hvem de er. Lekekamerater må være forsiktige.
Okay, in the start, we were primarily performing for the various audiences. But very soon, we started more and more to assist patients, parents, and hospital staff to perform together with the music therapist or alone. It is one boy singing. Sometimes during the musical hour, we constructed instruments that children could play. Here is a double bass made by his infusion stand, you know, with a big rubber band. And he was, you know, big soloist, like, you know, he was really playing well, double bass, infusion pump. And he took with him that skill to his room, so he was kind of practicing in his room to perform at another musical musical hour. And we also had many children who just popped in for a regular check, and they very often said, we have something to share with you at the musical hour. So she just skipped school for 1 or 2 hours, and now she's playing for the audience. She's playing even Grieg. Very nice girl who was very sick with cancer, and one of my good friends 2 years earlier. Further, and when she finished, she just, and then she goes home, or be home. And of course, it's nice when the young patients and the parents are looking forward to be visited by the music therapist or to perform at the musical hour. But it's even nicer when they are able to spend the often long hours of hospitalization with working creatively or meaningful, like often with making music. Also when the music therapist is not present. And modern music technology, like GarageBand, and if they are bringing their own instrument to the wards, is another. I often encourage fathers and mothers who have an instrument, as long as it's not a grand piano, like the guitar, to get it disinfected and brought into the isolation room. And I give you one example of this. One father in his mid-30s lost his wife through cancer in January, lost his job in March, and in April his daughter was diagnosed having leukemia. And he had 2 other children. The oncologist said to me, this man is completely knocked out. But he arrived to the musical hour with his daughter. And for half a year, I had very little with the daughter to do. But as many men, he wouldn't complain about his depression or whatever it was. But he was very interested in my instruments. And I asked him to play anything. I have a desk recorder. And I said, let's face it, you have to stay in hospital here for the next 2 years, more or less, on and off all the time. If you like me to teach you, I can teach you play the recorder much better. But you have to buy a treble recorder. And next week he had bought himself a treble recorder, and 1 month later he had bought himself a tenor recorder, and actually half a year after he had bought a sopranino, and one day his little daughter ran up to me when I entered the ward and said, "Oh, listen, you must come to our room and listen to my father. He has been so good at playing the recorder." And that's kind of musicalizing the hospital room, I guess. But many of the medical staff said it's so difficult to take part in the musical hours at that time in the morning. Couldn't we have another weekly go between the shifts, 3-4 o'clock, because they had the pediatricians band, so to say, and they very often accompanied patients, and very often the music therapist in the middle, one of my students, and you saw her in the first video, she was conducting and arranging for them. And here we also had the patients then performing with their doctors backing them. as I'm sure it was on here as well, but this was in Norway. And you might think that all these things are done from the music therapist, so to say, initiative. But this is from a Norwegian textbook in oncology nursing. And I show you these pictures just to show how this nurse, artist, author, she's also actually a good guitar player and rock musician, has kind of transformed the ward in one of the hospitals with so many small rooms where there are musical instruments, and they have jazz cafe in the evenings and things like that. The next example is simply how may one song contribute to musicalize a pediatric hospital department. Some of you know my research on the life histories of songs, but now I'm not interested in so much the content of the songs, but actually where were they made, performed in the hospital and outside. Is it possible to say that the song may musicalize anything? But let's see here. I checked where the songs from 5 different patients had been performed or made in the hospital. Of course, after some time, it's time, the song gets out of control. And we'll just check a few things with the first song Mary wrote. She wrote actually 10 songs while she was hospitalized. And that was the first lyrics she wrote in her life, and completely without any assistance. A lady came into the room suspiciously cheerful. I will have some blood specimen. Just a small thing, then all is over. I started crying, I really yelled, hold the patient, said the lady, but I didn't want to be stung anymore, so I fainted. And I'm not claiming that all songs of children is autobiographical, but I actually asked her, because she didn't write she didn't want to be stung, and I asked who was that, and she said that was me. So that was clearly autobiographical. Actually, what happened now was that this goes from the late 90s till the present day, actually. She was 8 years old, and she had acute myelogenic leukemia. At this time, Mary had almost no voice at all, and she was continually more nauseated. But I collaborated with the father to make a musical arrangement that she might like. I recorded with me singing, and the first performance was in Mary's room, where the recorded version, according to the father, was played daily, often before some suspiciously lady entered the room and the pandemonium started. The father also claimed that listening to the song made everyone in the room able to see the situation a little from above, and it actually created some order in the madness, as he said, in a repeatedly stressful situation for everyone present. Mary gave a recorded version to her visiting teacher, and the parents copied it to send it as Christmas gift, but that was outside the hospital. And the little 5-year-old brother, he had made his own farting version. Of course, he had no, nothing about that. We can hear the patient sing the farting song. That's for the mother. And then keep the keep the fart, but I didn't want to fart anymore, so I okay. I had the pleasure of conducting the pediatric staff choir, and then I made an instant arrangement for this song, and that was now played in the hospital festival hall, so to say, for other patients and the family of the doctors and nurses. And here the males are the patients, and the female singers are the suspiciously cheerful lady. Okay. And it ends with all the doctors fainting in front of the patient. I assure you, children in hospital loves this. Some few months afterwards, we were invited for a TV show to play in the hospital. And I should accompany her. And just 20 minutes before, this was back in her old hospital, because she had been in 2 different hospitals. She used that song as a visiting card to present herself for the new staff in the new hospital. But now she whispered in my ear, I don't want to sing.
Okay.
But the TV, they're shooting the film now in 5 minutes. I can play the piano. But have you played the piano before? No, she said, but I can learn it. So here you can see this is how to play piano without really crying. I'm singing and she plays piano. And if we now check in 15 months how this song has been wandering from one room to another, from one hall to another hospital, and actually into the homes of all Norwegians, it's kind of, I think it's a reasonably good example of showing one song made this. And here is a German version. So it probably might have well been sung in German hospital. And here is a Japanese version. And Setsu said she was teaching Japanese children to make songs through this example. But the funny thing was that just a couple of years ago, Mary, now a student, directs, produces a 22-minute long short film, a documentary about her life in hospital. The song is a part of the soundtrack of the movie, as well as during the rollerblades at the end. The Sick Girl, A New Perspective, investigates what happened to Mary during the 15 months of hospitalization. She has never talked with anyone, her parents included, about this period of her life. And I just show you some stills from the film based on the family's videos. Here's the mother, here's Sverre Lie, a famous child oncologist, and here is the father, who absolutely didn't like to talk about these things. And she showed the musical kind of activities. And the funny thing is that she's not naming me a music therapist, but a singing pedagogue. And I think that was because she didn't want these things to mix with therapy. She had so much therapy. What I did was to help her with the things she was really good at. So my assertion is, these examples of musicalizing suggest that the regular musical event, like the weekly musical hour, or a song created by a patient and a music therapist, like a suspiciously cheerful lady, may contribute to a pediatric department marked by a culture of dialogues and creativity and moments of leisure and joy. And how can we strategize to get such things to happen? I think the music therapist must be a relatively versatile musician and must be willing to work without a safety net. I've shown that these examples for music therapists in Europe who say we don't want to be watched all the time. other staff. And to cooperate with other professionals is probably the nice thing. And the last thing is enthusiasm. And without enthusiasm and lots of patience, we don't come so far. I'll just say thank you.